Alors, bonjour à toutes et à tous. Bienvenue à ce point de presse du premier ministre du Québec, François Legault. Monsieur Legault est accompagné aujourd'hui du ministre de la Santé et des Services sociaux, Christian Dubé, et du directeur national de santé publique, Dr. Horacio Arruda. Monsieur le Premier ministre.
Mr. Premier, you have the floor. Good afternoon, everyone. I'm happy to see you again in Quebec City. And, well, please, let's hear this great news. For about 10 days, the number of cases has been decreasing. We had reached a plateau at around 2,500. Now we are at about 2,000 new cases per day, in average, which means we're on the right track. It also means that the curfew gets results. And this is important. Why do we see those results? It's because people are not going out after 8 o'clock p.m. There are less interpersonal contacts in homes. Less contact means less contagion. Thus, this measure is working very well. And I want to thank, first of all, Quebecers. The great majority of Quebecers are following the curfew, respecting the measures at 8 p.m., and I want to thank Quebecers. The number of cases is decreasing, as you can see, and second of all, we saw that with the new numbers we anticipate, with the forecast, we can think that the number of hospitalizations will go down in the upcoming weeks. Very great news. Thank you to Quebecers. I want to say thank you also to the police officers. They don't have an easy job to do. You've heard me speak during the last weeks. I've asked them to be a little bit tougher, more strict, to give more warnings and to give more fines. You've seen some documentaries about that maybe, or some stories about that in the newspapers. So with the 8 p.m. curfew, it's hard for them to explain things to people if they're in a home after 8 p.m. And so it's hard to explain things to people. So the curfew has been well enforced. I want to thank all the police officers from the regions of Quebec. They do an excellent work. Of course, their work is not easy, but it's absolutely necessary. It enables us to save lives. Talking about police officers, I would like to take a few minutes to tell you a little bit about a debate we find we've been faced with in the media for the past days. We see the opposition mentioning a few things about homeless people. I would like to tell you that I was moved, as was the case for everyone, with the death of Mr. André. This is not normal a situation in such a wealthy society as ours for anyone to die in a Port-au-Sand chemical toilet. It's not normal, and we are all moved by that. I'd like to take advantage of this opportunity to address all the new community and all the population and give them my condolences. So we've proposed an action plan. Yes, there's work to be done so that people are treated the same way as all citizens. I want to come back to the work of police officers. Police officers know the reality that homeless people face. I was talking to Yann Lafrenière. He was telling me that most of the time they know them individually. Police officers know these homeless people, and police officers are not having fun giving fines to homeless people just for the sake of it. No. Police officers understand that homeless people don't have the means to pay those fines. They don't do it on purpose to give those tickets. Their goal is to bring them into a warmer setting, to a home. Some don't want to go to those homes, but that's their goal. As a premier, my duty, my responsibility is to find the right balance so as to enable police officers to enforce measures like the ones pertaining to the curfew. The curfew saves lives, and this measure, we hope, will help us save our health network. So what we're trying to do, what we've been trying to do since the beginning, we've been trying to save homeless people. We've added hundreds of home places, as we call them. We'll announce new ones today. And as we go, as soon as we see that there's a greater need for those places in the homes, we'll do that more. We started vaccinating homeless people also. So I believe that the government, and I'm thinking about Lionel Carman, this is dear to his heart. This is very important for him. He does his best to help homeless people. And I think this is quite unfortunate, as a matter of fact, to see that some people are trying to divide us. They are trying to say that there are good people and evil people, bad people. Some people love homeless people, some hate them. No, not at all. We all want to help homeless people. This is a complex situation. Now is not the time to divide ourselves. Now is the time for us to work together. Now, if we want to work together and not get divided, I want to say a few words about what we saw yesterday in Washington. We've seen a great message of hope throughout the inauguration in the U.S. We know that Americans are divided. We are faced with a situation where in the United States we see a lot of tension. But what I wish Americans is that with their new president, with Mr. Biden, he was extremely clear about his message, the one he delivered yesterday, calling people to avoid division. He wants to find ways for U.S. citizens to find peace throughout this whole situation so that we can create there some type of strength and optimism. This would be good for the U.S. This would be great for the whole world. So we wish them that they can find some peace throughout those tensions so that they would be facing less division and so that people would all work towards common goals. Now let's come back to Quebec. Great news, and hats off, Christian. We've just been announced that, I was told before coming here, that all the CHSLDs, I'll have to, I'll need a new take here. So I want to say it again. I want to say that the vaccination is finished for all these CHSLDs in Quebec. For the first round of vaccinations, this is now finished. So this is great news. So we're going towards our goal. We're on the right track, but, and this is a big but with a capital B, we still have a lot of things to do before us. The road is long, and the most important number that we have to consider, it's the number of hospitalizations. Today, we have 1,453 COVID patients that we find in our hospitals. That's what we have today. This is too high a number. It's way too high. So we must avoid offloading activities, postponing surgeries and treatments. We have to stop that. And we should catch up and decrease the length of our waiting lines. And so for Quebecers that are waiting for a surgery, for a treatment, it's been postponed maybe twice or 3 times and so on. I understand that they are facing a lot of stress. If you know you will have a surgery, but you don't know when, and the date is always postponed, I understand that this puts people under a lot of stress. And that's the very reason why, and by the way, I want to insist on this today, even if the number of cases is decreasing, as long as the number of hospitalizations will be as high as that, we cannot envisage within the upcoming weeks that everything will be reopened and that will suddenly be able to allow for contacts again, interpersonal contacts. This is true in Montreal, specifically in Montreal and Laval. It's true also for the greater Montreal region because a big portion of hospitalizations, I think that out of all the 1,400 and more hospitalizations, 1,400 come from the greater Montreal region. So we've talked to a lot of unions, nursing unions. We've talked to the two medical federations, but we have to be able to, number one, reduce the number of hospitalizations, number two, stop the offloading procedures, and start to reducing the waiting lists. They're too long. And so I ask Quebecers to be patient. We are somehow fatigued, tired. Even though statistics are improving, we won't be able to reopen everything within the next weeks. We have to focus, as I say, and I'm insisting on that. We have to continue protecting people who are over 65 years and over. 84% of hospitalizations, this is for people who are over 65 years of age. 95% of deaths due to COVID are people who are over 65 years of age, 65 or more. So that's where we have to focus. We have to focus on that, and that's where we must work harder. When I say working on that, I mean we have to think about the staff people. Christian has to work with these different staff members and with the different CEOs and people in charge of managing the different hospitals from Quebec. So every day they have to work with staff people who are extremely tired. It's been 11 months that the staff workers, the nurses have been working. They're going to the front. And if somebody in Quebec is saying, could I cheat a bit? Could I slack a little bit regarding the different guidelines? Well, don't do it, because think about these people who have been working. They're going to the front. They've been doing so for the last 11 months. I'd like to repeat my request before the federal government. And we'll see that every Thursday we'll have a meeting. We'll have a meeting this afternoon with the other premiers from the other provinces, and this evening we'll have a meeting with the Prime Minister, Mr. Trudeau, and I would like to repeat my request vis-à-vis the federal government to ban the international travels which are not essential. So I should not insist on that. We remember what happened in last March when people came back from the school holidays. If you understand what's happening elsewhere, there's a new variant of the vaccine, the UK variant. This is a full disaster. It's the worst of the worst in terms of situation, in terms of the death toll and the situation that prevails in hospitals and so on. In England, a country in the UK where they have a lot of resources, we do not want to face a situation like that. And we've continued talking to the federal government, and we are open to a new alternative. This is considered in New Zealand, I believe. The idea is that for all travelers, if ever we don't cancel non-essential travels, for all travelers coming back to Quebec or even to Canada, they would need to be quarantined in a hotel room for 14 days. This must be monitored, and these rooms should be paid by travelers for these 2 weeks. And I hear Mr. Trudeau, he would say that constitutionally speaking, this wouldn't be necessarily an easy task to cancel flights. I won't get into that conversation, but the alternative for us, we're open-minded here, would be to say, for all travelers, there are hotels that have a lot of rooms. It's not a difficulty for us finding hotels with rooms. There's a lot of vacancy. So finding hotel rooms hotels that are supervised, monitored by the RCMP maybe, or by the Quebec Sûreté. They would come in and help us. Maybe this would need to be paid by travelers. I don't believe it's the duty for all Quebecers to pay for these hotel rooms, but the travelers would pay for those hotel rooms. So we have positive things. This is encouraging. We're on the right track, but still we have a lot of work to do, especially when we consider the statistics regarding hospitalizations. We have more than 1,400 hospitalizations, namely for nurses, regarding the staff members within our health network. We need to continue working hard for them, and we'll need to sustain that for weeks. I don't dare saying for how long, for how many weeks, but we'll see how things evolve. But the best way to say thank you to the nurses is to follow the health guidelines. And as much as possible, amongst things, do not visit people who are 65 years of age or more. Let's remain united through this. Let's remain strong and let's remain proud. Thank you.
Numbers show that we've been going in the right direction since 10 days. This means that the curfew is paying off. There are less gatherings after 8 p.m., less contacts, and less contagion. I would like to thank Quebecers for their efforts. And I would like to thank our police officers for their work with the curfew. I want to say a few words about the situation of the homeless. I was touched, like everyone, by the recent death of a homeless man. We're all human, and it hurts to see someone die like that in our society. And I want to offer my condolences to the family and the community of Mr. André. Our police officers know very well the reality of the homeless. They won't give them tickets for fun. Their responsibility is to help them and guide them to a shelter. But we also need the tools to enforce the curfew that is saving lives. We're trying to find a balance for the good of all, and we'll continue our work to protect the homeless. So like I said, we've been going in the right direction over the past 10 days, but there's still a long way to go. We need to reduce the number of hospitalizations. That's why we cannot hope to reopen everything in the next few weeks. We must be patient and continue our efforts, especially with people over 65. Our nurses have been fighting the virus for 11 months now. If you're thinking of breaking the rules, think about them. The best way to help and thank them is to follow the rules. So we need to stay united, stay strong, and stay proud. Thank you. Et je voudrais maintenant passer la parole à Christian qui va parler.
I'll give the floor now to Christian. He'll talk to you. You've seen that he wears a mask. Now, there are some needs for contributions from Emma Quebec. You'll notice that I have a red mask. This is for Emma Quebec. There's a blood clinic next week in the La Prairie region soon, and Emma Quebec told us the great news for us today is that appointments are full now. A lot of people are there, have taken their appointment yet. So it's important to thank all the people that have helped Emma Quebec since the beginning, because our blood stocks are really filled. They've been so for quite some time now. now, but things can change quickly. We have a lot of people in our emergency rooms, in intensive care, in hospitals. So Quebec was asking me to convey this message to you. Yes, our reserves are filled, but be generous with your blood contribution because this is extremely appreciated from the population. This is a small message. Please help Emma Quebec, and thank you on their behalf. Thank you, Mr. Legault, Mr. Dubé. Mr. Arruda will answer the questions from the press right now in French first and then in English. First question from Radio-Canada, Véronique Prince. Mr. Legault, you say, okay, it's encouraging, we see the numbers, the statistics, and we continue, we're on the right track. The date you provided was February the 8th as a main goal, and you're saying don't expect leaving the confinement measures. You give hope, but then you discard the hope because you're saying we're not opening or reopening soon. What are your criteria? Because we're almost, we have reached almost 1,500 new cases. So what are the criteria in order for you to lower the restrictions? There are over 1,400 hospitalizations, which means that we cannot use those beds, 1,400 of them, that we can't use for treatments and surgeries. Right now, we have to proceed with some offloading measures, and we need to play catch-up also. So there's a significant reduction. There's a drop. I cannot give you these statistics because we would have to give you a breakdown by hospital and by region. 1,400 hospitalizations, that's way too high. And the beauty here is that we could say that since there's a decrease in the number of cases, 2 weeks later, we see a decrease in the number of hospitalizations. But for now, as long as this is high like this, we can't think removing restrictions, lowering them, and definitely not in Laval or Montreal where we find most cases. We're talking a lot about we're talking a lot about travelers. In Quebec, there are people contracting COVID-19, but to what extent do we know if they are following their quarantining measures? What are the measures that we implement to make sure that people in Quebec must be under a quarantine measure? Answer, we have to be careful, of course. Travelers, as we say, only account for a small percentage of cases. But now, when we hear that argument that this represents only maybe 2%, well, we have to think, and Dr. Laruda can further clarify this, but we're concerned a lot about the new variant for those travelers. The new variant, we see a boom, a spike in Europe. This is related to this new variant in England, notably. About your question, we must work hard also on our side, since we told people that we wanted them to help us for tracing, once we do the screening, we must trace people. Now, we feel there's been an improvement. We've seen a drop in the number of cases. We were able to do that. So for the tracing people, it's easier to follow up on people who have less cases. In Montreal, we have almost 50% less cases, so our tracing teams can provide a better and easier tracing and follow-up. And so people comply better. They're not afraid to pick up the phone, and they know that there aren't any penalties if they talk about someone and so on. So this is much better. But so with more time and availability, we will need to provide our follow-up also. And public health authorities don't do this in a coercive way, because we can't say on one hand, okay, tell us who you've met with, because we're here to protect you, and at the same time we cannot penalize people. It's trickier. So since we see that the number of cases is going down, we're much better positioned to provide that follow-up. Alain Laforêt, TVA. I would like to echo what my colleague is saying. Mr. Legault, you're preparing Quebecers, from what we can hear, to hear that there will be an extension of the curfew? Answer, we cannot exclude anything. Everything's on the table in Laval and Montreal, notably. All I'm saying is that as long as we have the high number of hospitalizations that we see right now, we can't slack, we cannot decrease the measures. If I may say something, you've seen the two studies this morning, the one from the INES anyway, but INES-PQ's study, I'd like to ask Dr. Arruda to say a few words about the difference between both. This may help you answer your question, at least partly. So, if I may, I'll say the same thing that the Premier said, but in different words. This is a virus that's prevalent everywhere, even though statistics are dropping. The virus becomes stronger through contacts, interpersonal contacts. Again, when you meet with people, you have to be under, you have to comply with a 2 meters distancing. Otherwise, you give the virus an opportunity to infect someone. If we look at the forecasts, if we look at the past 2, 3, 4 weeks and the statistics, in view of the disease, they can come up with forecasts. Since we have so many cases, we're expecting to face so many hospitalizations and so many ICU people, and so the death toll should be XYZ in view of what we've faced in the past. Mr. Brisson has conducted some studies. He's a model expert working with modeling statistics. He looks at the modeling and the behavior of correctors statistics, but also the impacts of behaviors and the vaccine. So he looked at some models. As soon as you drop things, you increase the number of interpersonal contacts. Let's say everybody follows the measures, complies with the curfew, and so on. People are careful. Then we can see that the number of cases and hospitalizations is going down. But as soon as we resume activities, as soon as people start to get in contact with people by 10%, even 30%, 10%, we see that numbers go high again. Before we see the full impacts of the vaccine, any great news means that if we are less strict, we know what happened, during the holidays. People gathered more, and so on. We saw what the impact of that was. So your individual role, everyone's role, my role, your role, is to decrease the number of interpersonal contacts which are not essential. You live at home, you may go to work, but avoid gatherings, because that's where we can see an increase. Let's say just 1% here, 2% there, left and right, and you will see what will happen in the curves. You will see from the Institute, when we increase contacts, we lose control over things. We'll decrease things, but then statistics will go higher again. We're almost at the final stretch. This is almost the end of it, but the vaccine is our hope, but as the Premier has been saying, we have to continue working hard. We should not think that even though, and I'm saying this is an if, this is conditional. We're not there yet. We're not there yet. But if we ease measures and so on, it does not mean that we should start doing again gatherings at home and so on. No. Because people may think that, it's not too bad and so on, but no, this has huge impacts. According to INES, we've seen the statistics, Marc Brisson studies and so on, because of behavioral statistics. Go onto the websites and you can see the results of these studies, INES studies, and so on, and you will see what happens behaviorally. Question. Dr. Arruda, you said we had 5 cases of variant. We've seen those in Quebec, this coming from the UK variant. Where are we at? Some doctors lied. They said they were not in contact with people from the UK, but they were. They lied. Could you punish people if people don't tell the truth? If they introduce a variant from South Africa, from Brazil, or from the UK, will you punish people if they lie to authorities? Answer. We've seen 5 cases, but should we punish people? If there's a case of negligence, and if we can show that there was negligence, maybe, but we don't recommend that people lie, obviously. If you admit your mistake, you may avoid some punishment, It's half forgiven, as we say, but we have to avoid transmission. Question. You've talked, Mr. Premier, about the inauguration, the new president in the U.S. You want to increase the number of exports and exchanges with the U.S., and you want to intensify the presence of Quebec in certain U.S. states. President Biden is more on the conservative side of things. What should we hope from this change of president in the U.S.? Answer, it's great news for Hydro-Quebec, assuredly. I remember that when I was starting to say that Quebec should become the main player, electrically speaking, in North America, people were laughing, but we can see that this is true. We're becoming one of the best players. Even some states like New York and Massachusetts, where you find Democrats. We had a first contract with Massachusetts. Now they have all the permits. This will provide for 17% of electrical needs. And the governor of that state told me if we can get all the licenses, all the permits, we'll immediately launch phase 2 of that power agreement. In New York, you've seen the news. Governor Cuomo makes this a priority. He wants even to participate in this transmission line initiative. These are great news. And if we're supported by a Democrat at the White House, this is even better. But we have to be careful because there's the Buy America and the Buy American Act. And with that, we have to be careful. If we look at the U.S. history, traditionally, Democrats were more on the protectionist side of things until this was true before the arrival of Mr. Trump. So we should not think that Mr. Biden will come in and everything will be easier in terms of bargaining circles and that it will be easier to negotiate with him. Not necessarily. We'll have some discussions with Mr. Trudeau, even today. So it's very important for us to understand that there's a whole chain, a whole cycle for providers. The same product can cross the border many times. And this is not good for Canadians nor for Americans to have regulations or acts like the Buy American Act. This is not positive for neither stakeholder. I think that things are more foreseeable if we negotiate with Mr. Biden. This is more, it's easier maybe to predict things than with Mr. Trump. So for the Canadian government, it will be important to review, revise the Buy American Act. And we have to explain that there's an edge here for the U.S. markets. There's also the rare metal sector in the United States that depend a lot on China in terms of commercial relations are not very easy between the U.S. and China. There's a great alternative that exists then. For us, this is an opportunity for rare metals. Let's say for manufacturing trains, tramways, the bigger players in the world. I mean, there will be an acquisition, Bombardier by Alstom, but the North American headquarters will be in Quebec now, which means that the contracts signed by Americans will go through Quebec. So beyond precious metals, we have great opportunity here because Alstom Bombardier's competitors are Siemens, they're in Germany, and the Chinese stakeholders. I mean, there are no big builders of trains and tramways in the United States, so we can imagine what might happen. We've talked about this, and for Alstom, we should not forget the fact that the main shareholder, it's the Caisse de dépôt. Serge Godin, the founder of CGI, will represent us. I've had an opportunity to talk to him so that we can set some objectives for ourselves. And so this is a long answer, which shows you that I'm really looking forward to addressing the economic reality. Question. You've talked about the risks that people might slack a little bit regarding the different measures, restrictions, and so on. If we cancel the semaine de relâche, the holidays, wouldn't that be a good way to deal with this? If we're talking about the semaine de relâche, the holidays, there are two things here. This holiday this week is not bad. If people decide to remain home instead of going to school, so this limits the spread of the virus. And there's another component. traveling outside of our borders. Now, again, that's why I've talked about the monitoring of the traveling return of Canadians. That's why I've mentioned that, and I want to talk about it with the Prime Minister. And so now there are collective agreements, and of course we have to comply with those agreements regarding the school holidays.
On discute beaucoup en Europe, notamment de...
Mr. Legault, Dr. Arruda. In Europe, there was a phenomenon that occurred in France. The contamination rate went down, and things were alleviated in the hospital centers. Now they're fearing in Europe a third wave. As soon as the month of March, in February and March, people fear that there might be another wave, a third wave occurring in Europe with the arrival of the new variant of the virus. Is this a scenario that you're preparing for? We've seen the first wave with that first specific characteristic. We had summer, and then we saw that the trend increased again. We never reached an exponential level, as was the case for other countries, but we're still under tension. I consider that we're still in the second wave. Let's say there's a new variant that would be extremely transmissible before going down from our plateau. We could see a new increase in the numbers. But again, we want to see levels going down before we can expect a new wave. That's why we're creating a very important system to detect genomic information regarding the virus, because we need to detect this early. Question. Let's talk about Israel. 25% of the population there has been vaccinated currently, so we can see the results, which are evidence-based about the vaccination campaign. And Pfizer and Moderna, the vaccines, have between 33 and 60% of efficacy. It's more 33% if we rely on the public health authorities. It's more 60% of efficacy, according to Pfizer. So what about the efficacy rate? They believe that the second dose of the vaccine would mean that this would increase the performance, the efficacy of this vaccine in terms of community immunization. So now we are postponing the second doses of the vaccine. What about the data coming from Israel? Will these data have an influence on you in Israel? How do you consider that? It's clear that we look at trends internationally. We read the newspapers, but we want to get the most evidence-based, peer-reviewed data. Some people say we must give 2 doses. There's people that say we should administer 1 dose to everyone, and that would save more lives. That was our position. We'll look at some publications. I'm not talking about the media. I'm talking about some medical publications which will enable us to recalculate things. You need to read some articles. Some articles will mention statistics between 33 and 60%. We'll look at peer-reviewed, evidence-based data. We've been doing that. We're looking at our data, considering the vaccination rates, whatever occurred in Quebec and so on. In the CHSLDs, we had our first round of vaccinations. We'll look at the situation and we'll decide, was this a failure? How have we dealt with the vaccine? Was it a failure or not? We're going to look at our own statistics. We have not finished the conduct of our studies, but if ever this changes, we would need to readjust. Perhaps we would need to readjust ourselves in terms of our plan. Maybe we would need to provide 2 doses for certain clients, or maybe 1 dose for others. We still believe that 1 dose for everyone saves more lives than just 2 doses for a few people. Question from Le Journal de Québec. To continue on this vaccination topic, we see that Canada is almost one of the only countries where you see delays over 1 month because of the Pfizer vaccination situation. Trudeau was saying that it's okay, it's normal to see that there are some delays. Doug Ford was begging the U.S. to give us 1 million doses. So you need to meet the premiers from other provinces. Can you speak together to ask Trudeau to intervene in order to face this vaccine shortage, if we look at what's happening in the U.S. and so on? Answer, this is a top priority for us. I have a meeting with the Prime Minister, Mr. Trudeau, this evening, and I'll meet the other premiers also. We were all disappointed. Doug Ford, we've seen it, and other premiers, we've seen that we were disappointed about the delivery of doses. And we haven't read the contracts. We don't know if there are penalties. Can we prosecute Pfizer? Can we force them to deliver doses? What about the plans from the U.S. and so on? This is part of all the questions we'll ask Mr. Trudeau later. Follow-up. I'd like to come back to the Couche-Tard saga, Carrefour saga. The Minister of Economy said that we have to be careful because some foreigners come here, they take over some Quebec companies, and this is the end of the world. According to him, Quebec should not imitate France and block some takeovers from foreign players. Doesn't that go against whatever you argued with Rona at the time? Isn't this contrary to your own nationalistic point of view, economically speaking? Answer, Pierre Fitzgibbon and myself, we both believe that headquarters are extremely significant. Whenever you have a headquarters, which means that you have jobs that are well paid, and you have indirect impacts for providers, businesses, consultants. This is extremely significant. All countries are trying to protect and develop their headquarters. Now there's a difference here. A lot of them have created some links between Bombardier Alstom and Couche-Tard Carrefour. In the case of Bombardier is facing some financial difficulties, so they didn't have a Quebec buyer ready to pay for whatever Alstom was ready to pay for the transportation division, Bombardier's division. This is a situation that is different. I was not surprised then to see that Mr. Macron, Mr. Le Maire didn't wish for the control, the Carrefour control. I mean, this is the company that has the greatest amount of employees in France. I think so. Anyway, we're happy to see this offer on the table. There's an election next year also on top of that. So this is a hot topic, politically speaking. Hence, we will further negotiations with the French government. At the same time, if I try to understand Mr. Macron's position, if a Frenchman would have made an offer vis-à-vis Metro, the answer would have been no. So it's about the same situation. Question from La Presse. Fanny Levesque. Good day. I'd like to know, beyond February the 8th, I know that all options are on the table, but at this time, given the current situation, what's the likely scenario? Are we talking about coming back to a situation, whatever prevailed before December the 24th? Are we going to get there? Or you talked also about Montreal and Laval. Can we understand that measures won't be enforced throughout all of the province? In all the regions? Answer, one of our goals was to come back to our color code or to our alarm level or the colors. We see that things are not evolving the same way. It's not happening the same way in all regions. Now, I'm not teaching you anything because you've been providing a follow-up on that for quite some time now. So I give you some statistics about the outbreak levels, what are the trends, what's likely, and so on, and also the numbers in regards to hospitalizations. That's why we are encouraged on one side, on one hand. In the Saguenay or in Quebec, maybe, as we've seen, the situation is much better. So that's why we're more positive. But things are still fragile. That's why I asked Dr. Arruda. I'd like to come back on that. INES's forecast, the National Institute, the INES-PQ, They tell us, be careful, because we have to take into consideration, we have to consider the reopening of schools. That is our priority, and we know that we'll have some contagions there. There's a spread risk there, but we could face that risk. We've said that. Now, I'd like to answer saying that the regional considerations will be important here. And as we can observe, Montreal is a very peculiar situation because the very density of the population is higher in that region. That's why we're working hard. This is a longer answer maybe, but when the Premier asked us to specifically deal with certain regions, to visit certain regions in Montreal, it's because we see some outbreak settings that are where the situation is worse. So we've seen how we could focus our efforts on certain settings. Hochelaga, Maisonneuve, Eastern Montreal, Montréal-Est, the north of Montreal. We asked our CEOs from the onset to work there, clinic mobile clinics, screenings. Also, we've talked about rapid testing and so on. We found some testings where this was fitting to do so, so we received some information enabling us to do so. So this regional base, we're looking forward to addressing that again. We want to go back there, but we cannot do it right now because in those regions we haven't seen yet that hospitalizations are creating the impact we so much desire. But I understand we're fatigued. It's been 11 months. We're tired, but it's just a few weeks now before seeing what will be the impact on hospitalizations. People say, what? Being patient again? He's asking us to be patient after 11 months? People are going to say that. But the news now is that vaccination will make some progress. And as Mr. Paré told you, we'll get some vaccines once we solve the whole Pfizer dossier until mid-February. And then we'll have a significant supply of vaccines that will come. So we need to conduct a blitz for the upcoming weeks. That's encouraging. It's the first time that we have this in terms of alternative for the vaccine. Follow-up. The color code, if we address this, have you learned anything from this fall situation? We see that rates are lowering throughout Quebec. We don't see any big outbreaks in some regions. So is there anything you've learned? Maybe you had problems when people crossed regional barriers, if you want, to go eat in restaurants in the neighboring regions, things like that. Have you learned anything? Answer. We've considered this and we're preparing something for the upcoming weeks. Namely, we need more certainty. There's nothing worse, by the way. I'd like to say this. If Mr. Horacio wants to say something or the Premier wants to say something, there's nothing worse than saying we're going to do this and then a few weeks later we would say, oh, we dropped the ball on this. No, people hate that. So that's why we've said, tell us what might happen in view of the behavior we've known. So we can ask things to Quebecers, but there are always exceptions, and we want to ensure that we understand this well. We want to make sure that a new orange code or a new red code would mean what? What would this mean? We want to understand this in order to get to the new reality. That's how I call it, while we finish the vaccination period. Anyway, it's a long-winded answer, but we're getting prepared. We have good news, but let's remain prudent in view of the upcoming weeks. I'll be short. I, again, ask something of Quebecers. Now, we've learned a lot. I'm learning a lot, and Quebecers also are learning. We thought that it wasn't that bad to gather with people and so on, but we've learned that, no, this is bad. So let's support each other. Let's work together. Some people believe that this would not be harmful. They created gatherings during the holidays, and now their parents are in an intensive care unit, and people are hospitalized as a result of those gatherings. So people have learned, and we're working together. Question from Le Soleil. I'll be brief. We've been asked to replace our masks with surgical masks, and the same thing prevails in schools in spite of using those fabric masks. I mean, there was an outbreak amongst people that were wearing those masks, but can we say that the protection is more reliable now than before? Answer. I've told you that wearing a mask is important. But if people don't wear the mask in a proper way, under the nose or over the nose or whatever, this is less efficacious. Obviously, this works less. If you don't have the right fitting, it's not going to be working. But we know through studies that it's important to wear masks. We have more masks available. We're trying to protect as many people as possible also. We see how things evolve if we get more advice and as soon as we increase our knowledge base. Now, for face coverings also, some face coverings are made of some fabric that protect you as well as some type of procedural mask. But again, we need to make the right decisions so that companies wanting to manufacture procedural masks, for example, that you could wash, or you can mass-produce some masks that are as efficient or effective, rather, than some procedural masks and so on. A procedural mask, if it's not used the right way, it's not going to be working well, It depends on how you wear the mask. It varies, it's complex, and so on. Question. Mr. Legault, you said that the curfew measures have been working. If case numbers go down, we believe that hospitalizations will drop. So how can we avoid playing yo-yo, when things will go up and down, up and down? Answer. As Christian said it, we don't want to play this yo-yo game, things going up and down, up and down. No. We want to see a significant drop in the hospitalizations before we lower our guard and lower restrictions. The curfew works. Why? Why does it work? Because there are less gatherings in homes. People meet less in their homes. And so, this is a good direction. Follow-up? Was there a problem with the curfew or... Answer. Before the enforcement of the curfew, people said, you don't have the right to welcome someone in your home if the person doesn't come from your own bubble. If people would have followed that guideline, we wouldn't have seen problems. But to come up with a clear guideline, if we tell police officers, make sure that this is enforced and that people follow this measure, nobody after 8 p.m., for example, then the impact is clearly that people welcome less visitors or less people in their own home. Question. Dr. Arruda, do you have scientific evidence which enables you to see what's the impact of the curfew in terms of the lowering of cases, or do you think that this is too early to say that? Answer. We have to understand this, and I gave a comment on that. I once said that I didn't have any scientific evidence. Well, I'm referring here to controlled studies, under control. Now, a lot of countries conducted studies, and we have observed a few things. We've seen that after curfews, we've seen that there was a significant drop in the number of cases. Now, this is an impact, especially when people do not follow some guidelines. Normally, people say, oh, I'm not going to follow with this guideline. Because of the curfew, they're not going to go against a restriction. So people comply more with restrictions because of that. So 2 weeks afterwards, after the announcement of the curfew, we've seen that there were less contacts, which generated less cases, a drop in the cases. Now, it works because it's a curfew per se. The impact of a curfew is that people will say, oh, I'm not going to go outside of my home because otherwise I'm going to get a big fine. Ideally, we would eliminate the curfew and people would behave the same, ideally, and we would have the same impact. We would see the same statistics. Question, Mr. Premier, the travelers coming back to Quebec, why shouldn't they undergo a 14-day curfew in a hotel under a monitoring from the Quebec Sûreté? Answer, I've talked to Ms. Guilbeault, and of course we could see what we'll see if the federal government could help us in supervising the return of travelers in hotels. We don't exclude that. Everything's on the table. The SQ could intervene. That's Plan B. Plan A is to convince the federal government. They have full powers on airports and on travel returns to monitor the situation. Question for Mr. Dubois. The proportion of patients and CHSLD employees, those that were vaccinated, do you have these statistics on that? Answer. The precise statistics, as we said a few minutes before coming here for CHSLDs, it's almost 36,000 patients that were vaccinated in CHSLDs, meaning that we have reached almost 100% of all the clients who have reached higher levels than our target, because we are talking about 40,000 people for all of the clients. We've adjusted things slightly during the last days because we had a few RPA clients that we included in this category, but we've corrected that small mistake. For CHSLD employees, I don't have the breakdown in order to know what pertains to only the network and only to the CHSLDs. A great question. I'll look at that tomorrow, considering the employees. I'll look at that tomorrow and I'll provide it. Question from Metro, François Carabin. Good day. Do you hear me well? Okay, thank you, Mr. Dubé. We've asked you earlier during the press conference what we should consider in terms of hospitalizations to alleviate things in terms of the sanitary measures, the curfew and so on, to lower restrictions and so on. What could we do to improve the situation regarding offloadings and in order to resume surgeries and medical procedures? Answer. I'll tell you a little bit about statistics. I don't have a lot of time, but at the end of November, if I may, for the Montreal region, we had between, I would say, between 250 and 300 hospitalizations. That's what we had for the greater Montreal region, and we had about 700 cases per day, 600, 700 cases per day. This is almost all the time the double in numbers. In that environment, we faced 70, 80% of numbers in the operations, which means an offloading of 30%. By 30%. So for the Greater Montreal region, namely, because cases have increased, hospitalizations followed, and we have reached now a situation where we have minus 50%. So we can conduct our operations, which means that we have more than 50% of offloading. This is major. We went from 70 to minus 50. Quite significant. The great news is that for the Montreal region, the Greater Montreal region, because of the agreements we were able to sign with the private clinics, more than 20 agreements, we were able to maintain that percentage, total amount, the breakdown between the private sector and the public sector. We have reached 50% in terms of operations. The surgeries that we want to protect, right? We are almost at 50% in terms of protection on that level. We have reached 50% of our objective, to answer your question, and that is precisely why we must ensure that we lower the level of hospitalizations to at least get to 80, 85% of what we did before. But the Premier has been saying it's not 85% that I want. I want 100%, 115%, because I want us to be able to lower our waiting lists. It's a long-winded answer. Again, I'm sorry, but I'm saying this because I was talking to all of our union reps, all the union representatives. All the nurses, all the staff members are tired, extremely fatigued. And now we're telling them we continue to keep on pushing because we want to reach 85, 90%. So that's why we always say, please be careful. Take care of our staff members, our nurses, and so on, because we need to lower the numbers. Thank you to our staff members again, because they've worked really hard. Follow-up. Along the same lines, we've seen the INES's study numbers. Does that set ourselves at a distance from the triage protocols? Answer. I wish Dr. Patonnet would be with me to answer this question, but I'll take a risk here. I think that in terms of triage numbers, this is great news. What we're seeing here. We'll keep an eye on that very closely. And we were talking about this a few minutes ago before coming here. We've seen some charts. You can't understand how many numbers we have in terms of simulations with doctors and so on. But I think that we seem to be at a certain distance from that. I hope that the next time she will see you, she will say the same thing. But I think that we've reached that level. And now we'll consider the English questions.
Premier Legault, you said earlier in French, we all want to help the homeless. It's complex. And you suggested people are creating divisions and implying some people care about the homeless and others don't. And for a lot of people listening, that comes across as a defensive response. So my question is, do you feel personally attacked because people are raising questions, concerns about your government's policies about the homeless during this pandemic?
Okay, what I said is that the police officers are doing a very good job. They know the homeless very well. Their objective is not to give them tickets. It's to bring them in shelters and help them. And they know very well that the homeless cannot pay tickets. They don't have the means for that. So I think we have to keep our confidence in police officers. And what's important also, and what's my responsibility, is to find a balance to help the police officers being able easily to apply the curfew, to make sure that everybody respects the curfew. So that's why I think that the rules we have, and I've asked the opposition and many people to give me one example of a police officer who took a bad decision, and they cannot answer that. So it's working well. And we have to be very careful about Mr. André. There's an inquiry about what happened. So before trying to say that some people will die because of our rules, I think it's not fair to say that. And we have to respect police officers, and I have 100% confidence in these police officers, and I think that the actual rules are the right ones.
On January 6th, you said there are enough spaces available for the homeless. And suddenly, within the past 24 hours, there are 250 new beds at the Centre Pierre Charbonneau, at the Montreal Soccer Stadium. So is that an acknowledgement that you originally misjudged the situation? You said there were spaces for all of them, and now all of a sudden you're adding hundreds more.
Okay. First, the situation evaluates. It evaluates also with the weather. At the time, they were telling me that we need 600 places. So we announced at the time 800 places to make sure that we have a margin, that we have a cushion. Recently, they told me that we need another 100 or 200. We said, hey, we'll put another 250. So, and what we're trying to do, and the police officers are trying to bring as many homeless as possible in the shelters. Some of them, they don't want to go, but they try to explain them that there won't be any bad consequence for them if they accept to go warm in shelters. So, yes, the number increase, but as soon as we know that we need more space, we had more space. But at the time, they were telling us that they needed 600 places, and we've put 800. But now they say that we need more than 1,000, including the 800. So we're doing it.
Philippe Autier, de Gazette.
Good day. A little question for Dr. Arruda. On Monday, you indicated that you had found one case of a variant, and you were investigating to see for 4 other cases that were linked to a traveler who came from the UK. How are you today monitoring variants, and are you finding any more?
Actually, I had no news, no new information from the lab telling me that there was a new other variants found. The way we do it, it's going to be especially on people telling that they will come back from traveling. They will be perhaps in quarantine. They will need some tests, so we will take those ones. And we also are going to have, I would say, test around 10% of our because it's 5. We're going to double it, 10% of different strains coming from everywhere. And if especially we find a place where there is an outbreak, a very fast outbreak with a lot of cases, we can also pick on those ones to try to find out if there is a new strain that could be coming from Quebec or from elsewhere, like in Brazil, the South Africa one and the UK one that is around the world actually.
And my second question is, I understand you are sticking with your dose timing strategy for now, but can you tell us what are you doing to monitor? It's a bit a follow to Louis' question. What are you doing to monitor the immunity levels that are being produced by the one dose that you're giving out?
In fact, we are following the data scientifically published by other countries that began before us. Like there is this Israel, I would say, media, different media numbers that have been published, but we want to have access to the scientific paper, to be able to calculate exactly the numbers, because they can vary in the way you make your calculation because of the methodology. And we are now actually following what we see, different places, like different CHSL days where we did vaccinate. There was some CHSL days that the outbreak was already there. We're going to take off the cases that have been infected prior the vaccination, look what happened with one dose, and calculate what we call it the vaccine efficacy on the field, and perhaps, if needed, do some serology tests to redecide what is going to happen. Actually, there is two scientific, I would say, way of taking it, which is giving the 2 doses like the company is asking, or protecting more people with 1 dose, which seems to be the strategy that we choose here and in UK. So, but we will follow it, and if there is some data showing that the efficacy is too low and the people need to have 2 doses before, we're going to change it, especially on looking at different ages of vaccine efficacy.
Will you be making that public? Will you be telling us what your immunity data shows?
Yes, I think that we do work that with scientific people at the Institut National de Santé Publique, and as they used to do, they make things public. I think it's clear.
Katsune, CBC.
Good afternoon. I would like to go back, Premier Legault, to your new proposition for international travels. Now that you're suggesting Prime Minister Justin Trudeau for hotel rooms being paid by travelers, how are you going to make that pitch later on this afternoon, and how convinced are you that Mr. Trudeau may accept this?
I've got 2 good arguments. The first one is what happened last year at the beginning of March here in Quebec. The second argument is what's happening in Great Britain right now. So I think we cannot take any chances with the new variant. So either we don't permit people to travel, and maybe when we talk about Punta Cana or Acapulco or all those places, I remember because what I did before, very often we negotiate with hotels, and our competitors are coming from Europe. So in the same hotel, you have people coming from Europe and some people coming from Quebec. So it's possible that the variant goes through Dominican Republic or Mexico and then come to Quebec. And when I see this situation in hospitals in Great Britain, we don't want to see that. So we have right now the quarantine for these people is not enough guaranteed for the protection of Quebecers.
Okay, I'll ask a clarification later on. But I'm just wondering, because you wanted to have this debate about essential and non-essential travels. Now you're asking customers in hotel rooms to pay for this quarantine for 2 weeks. But then you still have this debate about what is essential and what is not essential.
Okay, but I think it's clear that if we tell eventual travelers that they will have to pay for 2 weeks a room in an hotel coming back, I think we'll have a lot less travelers also. Eh? So, yes, it's not that easy to make the difference between essential and non-essential, but we're open for discussion. I think that there are many ways to put these definitions in practice.
Go?
Pour la précision, rapidement, oui.
Oui. About the curfew, you're not ready yet to say, well, on February 8th, this is what we will be doing. But how do you see, because you talked a lot about the behavior of Quebecers, how do you see these reports coming, putting a doubt, questioning about vaccines and their efficiency? If we're in the midst of this curfew and you're asking Quebecers to basically to respect the rules, things are getting better, so we might lift this curfew at some point in February. So how basically stressful it is for you to see reports putting in doubt the efficiency of the vaccines?
I'm not sure I understand your question, but I'm trying to rely on public health. And regarding the curfew and its impact on the actual situation, it's going well for the number of cases, but still we have a lot of work to do to reduce the number of hospitalizations. So it's not a clear science. I'm looking for the guide and I cannot find it. So we're trying to do our best, I can tell you.
Raquel?
But, yeah, okay.
Yes? Okay.
It's okay.
Raquel Fletcher, Global News.
Good afternoon, Premier.
Yeah, good afternoon, Raquel.
Thank you. I have a question about ventilation. We're speaking with industry experts who are strongly criticizing the report that came out about ventilation in schools. They say, for instance, the government requires air purifiers to be in places like dentist office. This is a requirement. So if it is installed by professionals, industry experts are saying that this could be a very great tool to cut down on transmission, particularly when you take into effect that the mask, after 6 hours in the same space, it becomes less and less effective. They also tell us that this is what is happening in Asia. So can you give us some insight into why your report shows something different, why you're not recommending air purifiers in schools when there seems to be experts out there who say this is wrong?
But maybe I'll start, then you can. First, you cannot compare a classroom with a dentist's place. I went to the dentist 10 days ago. I have one teeth less in my mouth. And it's clear that you can orient the purifier when you have only 2 persons, 3 persons in the room. When you have 30 in the same classrooms, where would you put the purifier? And how many do you need? And that's what I understand. But I'm not the specialist. You are.
Yeah, but I'm not an expert in ventilation. It's why we ask experts from public health and from others' expertise in aerosolization to do the report. And I just can tell you there is always people who have not the same opinion as other experts. But recently, others, scientific organization, especially in the United States, have been telling that at the same conclusion that we did here in Quebec. in certain conditions, those things could be helpful, but in schools, the way it is done in a regular way, I think even can be dangerous, but not. So I think we are not taking those decisions on the corner of the office. We are asking our best people to give us right analysis, and you will always find some experts from another company or others who will say something different. But we are thinking that that's the best thing is what is recommended for Quebec. And even if we do recognize there is aerosols transmission, it's not the main thing. I think that the distanciation, the masks, and everything is something. And in certain conditions, like in dentist rooms or in certain healthcare settings where there is a big chance of aerosols, and it's controlled in one room and put by experts, that could be helpful. And it's what is going to be done in Quebec.
Thank you. I have another question about the curfew. You seem to be saying that even though it's early right now to have all of the facts, you seem to be saying that it is working. However, you have warned, and we've seen this before, where you have also made similar warnings. If the rate of hospitalizations, the number of hospitalizations don't go down, you will not lift that curfew. Are you priming Quebecers for a curfew and for these measures to continue, and for how long?
I don't think we're priming anybody. I think people went through so much in the last year that we're just telling the facts. I think that so far we see this curfew being a complement to all the other measures is working. And I think that let's look at the next 2 weeks. That's the reason when we announced this very difficult decision on January the 8th, we said we had the decision. Do we go for a curfew of 3 weeks or 4 weeks? We were debating that. We said we better take a longer period, which is tough. But we said within 4 weeks, we should see the effect. So we're halfway there, and we see the beginning of the effect. On the number of cases, it's clear for everybody. On the number of hospitalization, Dr. O'Patterney was telling me again, she said, don't say 7 days, say 10 to 14 days, because sometimes it goes up faster and it takes longer to go down for obvious reason. How long the people stay in hospital, what are the mix of aged people that we have in there compared to young people. So the short answer, we're not framing everybody. We're just telling people, just do what you do for the last 2 weeks. And I think that should work. That's what we're saying. And we see the facts every day. So let's cross our fingers that this curfew continue to work. That's the only thing I would say.
C'est ce qui me fait un point de presse. Merci beaucoup tout le monde. Merci.
And this concludes the press conference.